In 1978, the birth of Louise Brown marked the culmination of years of scientific research. She was nicknamed the test tube baby. Since then, over 2 million babies have been born using IVF, or in vitro fertilization. IVF is the process of fertilization where the egg is combined with sperm outside of the body, or in vitro, which means in glass. Currently, my daughter-in-law is going through in vitro fertilization, so this scientific research has been very personal to my family. There are 5 basic steps to IVF. There are her diagnosis, the treatment plan, stimulating shots, egg retrieval, and embryo transfer. For the diagnosis, based on your medical history and gender, there are several tests that need to be done. They include an ultrasound, diagnostic labs, an HSG, which is a series of x-rays using contrast dye of the uterine cavity, and a semen analysis and/or surgery. A vaginal ultrasound is used to count the follicles in the ovaries to help complete the overall picture for your physician and determine which treatment plan is correct for you. Diagnosis labs test for estrogen, which stimulates the growth of follicles and the production of fertile mucus from the cervix and prepares the uterine lining for the egg. FSH is a follicle stimulating hormone and is necessary for the development of the egg. And AMH, anti-Müllerian hormone, indicates the size of the ovarian reserve. LH, luteinizing hormone, releases the eggs, and progesterone stabilizes the uterine lining. Once all of these labs and results are back, a treatment plan is formed with your medical team. There are 3 types of medical treatment plans. The first type is pretty low tech. It's just timed intercourse, which based on your ovulation cycle, that's when you plan to conceive your child. The second is artificial insemination, where semen is inserted manually by a physician at the time of your ovulation. And the third and most complex is what my daughter-in-law is going through currently, and it's IVF. First, the physician must determine that it is necessary because IVF is extremely expensive, starting at $15,000 and not covered by most insurances, and that price does not include all of your daily medications. It must be determined that you have to go this route. The first step is the patient takes 30 days of birth control medications. This is to regulate your ovulation cycle. Then the patient starts oral medications and injections. The injections are Lupron to prevent spontaneous ovulation, Manipur, and Gonal-F, which are for follicle stimulation. Oral medications are Fulgard and CoQ10 for egg quality. The patient must also see her medical team daily for tracking of follicle growth and hormone levels, and then her medical team will adjust the medications as necessary. After 7 to 14 days of taking all of these medications, a trigger shot will be given. That medication is called Pregnal, and it is to start ovulation. The next step is egg retrieval. This is a surgical procedure where the patient is put under general anesthetic. Then using an ultrasound probe for guidance, a 20-inch surgical needle and syringe is inserted into the uterus to drain each follicle. Then an embryologist takes the fluid and separates the mature eggs. At the same time, semen is collected, and then the embryologist fertilizes the eggs in vitro. The next morning, they count the surviving eggs. Only 60% of fertilized eggs will survive the night. For my daughter-in-law, they only had 2 embryos that survived. The transferring process begins again with birth control. They take the birth control for 30 days for ovulation accuracy. Again, because this is so cost prohibitive, you want to make sure that everything is done accurately. Progesterone is started to thicken the uterine lining. Other medications introduced are estrogen pills, estrogen cream, progesterone cream, prednisone, Lovenox, which is a blood thinner, and aspirin. Regular ultrasounds to check the thickness of the uterine walls must be at least 8 millimeters before they will implant the embryos. During implantation, the patient is awake, and under ultrasound, the embryos are inserted into the uterus using a long surgical straw. The patient then goes on bed rest for 3 days. All of the meds are continued during this time. 14 days later, HGC blood test is done to determine pregnancy. If a positive test, in 2 days, they will do another test to see if the levels of hormones have doubled. If it has, in 5 weeks, an ultrasound will be done to check for heartbeat or heartbeats. At the 9th week, the patient will be released to a high-risk OBGYN. At any time, something can go wrong and the patient will have to start all the way over from the beginning, and the money resets as well. This $15,000 does not include medication, so the price is just way too high. But can you put a price on a child and starting your family?